Our nation's life expectancy is declining, and it's not a priority for lawmakers. That's according to the Food and Drug Commissioner, who says we're facing a public health crisis. The CDC report said during the pandemic, life expectancy for the average American dropped to its lowest point in almost 30 years. And while the agency's latest vital statistics report shows life expectancy has started to rebound as a result of decreased COVID-19 deaths, heart disease, cancer, and homicide, there are no bills or legislation on record that directly address Americans' shortening lifespan. Let's bring in Dr. Frita Fisher, a medical expert in nephrology, medicine, and pediatrics, and founder and president of her own nephrology practice in Atlanta, Georgia, which focuses on kidney disease. Dr. Frita, good morning, and thank you so much for joining us.
Good morning, Nick.
You know, you and I have had conversations around healthier foods and what people can do to live longer because, so many of us love the things that aren't good for us. But right now we're talking about Americans dying sooner than they should. Why is this a bigger priority? Why isn't this a bigger priority for lawmakers when we know that the numbers are there?
Well, it absolutely should be a big priority because not only is our life expectancy low, it's actually, when you compare it to other high-income countries, the lowest. You have countries like Norway, Portugal, you have places like Japan who have life expectancies over 80. We, on the other hand, do not. We have the lowest life expectancy among high-income countries, yet the highest healthcare costs. It's not a political issue because, quite frankly, if politicians were to launch bills, it could be a losing political issue. For example, we know that the #1 cause of death among our children is firearm violence. But in order to correct this and increase the life expectancy among our children, you would have to have gun reform. You would have to decrease access to guns. And that's just not a winning political issue, especially for conservatives. Also, chronic illnesses like heart disease, kidney disease, these are things that shorten our life expectancy. But in order to target the populations which really need help with chronic medical illnesses, like Native Americans, like Black people who suffer from low life expectancies, you would have to expand healthcare access. And unfortunately, this is a losing political issue for many. The other thing, Nick, if you were to implement a bill for life expectancy, it may take years for you to see a difference. And you can imagine if you're someone who is a representative and your term is only 2 years, then by the end of those 2 years, you may not see the fruits of your labor. And you could be seen as having a losing or unsuccessful life expectancy bill. And so a lot of politicians like to steer clear of it, even though our short life expectancy is indeed a public health crisis.
And Dr. Frita, you and other medical experts have worked in this field, so close it out for me. What type of healthcare reform overhaul does the nation need to do to get back on track and tackle this public health issue?
Expanded healthcare access, expanded Medicaid access. Also, we need to make sure we invest in preventive care. Right now, unfortunately, physicians don't get reimbursed very much if they prevent heart disease, prevent diabetes. It's actually treating these diseases that will really generate revenue. But if there are more incentives in preventive counseling, then we can get to the point where we can shorten healthcare access. And of course, if we have gun reform, then we can decrease firearm violence, again, the #1 cause of death among our children.
And it's not all doom and gloom. You can go to drfrita.com to ask her some of these questions yourself. Dr. Frita, thank you so much, and Happy New Year to you and your family.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.